Today we will be talking about the assessment and monitoring of postoperative patients. First and foremost is the immediate postoperative period. It is during this time that we must look for early warning signs of complications, mainly based on the patient's vitals. Vitals postoperatively should include a level of consciousness, which may be impaired depending on what sedative agents were used during the surgery or if the patient is receiving any opioid analgesia. Early assessment should include a complete head-to-toe assessment, a pain assessment, checking capillary refill time, checking intake and output, and oxygenation status, including O2 saturation and the amount of oxygen administered. It will be important to look for specific postoperative complications, including hemorrhage, shock, sepsis, and any side effects from anesthesia. Remember to assess pain early on, as it can lead to symptoms and changes in vitals that may look like other serious complications. Vital signs should be performed per hospital policy but are generally pretty frequent. They should be compared with baseline vitals, including those before, during, and after surgery. The nurse should also be aware of patient-specific parameters and notify the provider if the patient is outside of those specific limits. Monitoring airway and breathing is essential because this is often the first vital sign to be affected by a change in cardiac or neurological status. Nurses should monitor and document airway, including if there is an artificial airway, the rate and rhythm of breathing, and if there is any respiratory depression, which would be indicated by bradypnea or hypoventilation. Ensure that oxygen is administered and titrated as needed, that continuous oxygen therapy is humidified to prevent drying of mucous membranes, and that the skin is protected to prevent skin breakdown. Typically, oxygen saturation should be greater than 95% unless the patient has a history of lung disease. If oxygen saturation is less than this, hypoxemia can occur. Assess that the finger probe is clean and reading properly. Shivering, peripheral vasoconstriction, or even dried blood on the finger can lead to an abnormal reading. Circulatory assessment includes rate, rhythm, and volume of pulse, blood pressure, capillary refill time, color and temperature of limbs, and peripheral pulses, all which assess peripheral perfusion. If systolic blood pressure is lowered and heart rate is elevated, this may indicate hemorrhage or shock. Assessing body temperature is imperative, especially for patients who are in surgery for a long time. An elevated temperature may indicate infection, but a low temperature may also indicate a bacterial infection or sepsis. Temperature needs to be monitored closely, and actions to maintain temperature within normal parameters. Use of warm blankets can help warm patients up, or when not sufficient, a forced air blanket like a bear hugger can be used. Antipyretics should be used for patients who are febrile following surgery, or other techniques like fans, cool cloths, or the use of a forced air blanket on a cool setting can be utilized. Patients should respond to verbal stimulation and be oriented to person, place, and time. A change in level of consciousness can be a sign of shock. There are many different scales to assess level of consciousness, including the Glasgow Coma Scale and the APVU scale, which looks at if a patient is awake and alert, if they respond to verbal stimulation, if they respond to painful stimulation, or if they are unconscious. To understand if there's a fluid balance, nurses should assess IV fluids and other infusions, as well as any oral intake. Urine output should be greater than 0.5 mg per kg per hour. If the patient has a Foley catheter, the nurse should ensure that the line is patent. She should monitor for output from tubes and drains or fresh bleeding from any surgical wounds. In addition, the IV site should be carefully monitored, especially when patients are getting a significant amount of fluid or medications that are caustic to the veins. Signs of phlebitis or infiltration include redness, heat, or swelling at the IV insertion site. Remember, while the electronic equipment can help you monitor your patient, it cannot replace careful nursing assessment and observation, including watching, listening, feeling, and observing your patient. That completes the assessment and monitoring of postoperative patients. Thank you.